Do you frequently feel like your heart is pounding, even when you're just sitting? Or maybe you feel unusually tired, like even walking to the kitchen drains all your energy. You might brush it off as stress or aging. But what if it's something deeper happening in your blood? Meet lymphoplasmacytic lymphoma, often called Waldenstrom Macroglobulinemia, or WM. Imagine your bone marrow, where blood cells are made, getting invaded by a crowd of confused immune cells. These cells start making too much of a protein called IgM, thickening your blood like gravy. That's why you might feel dizzy or have nosebleeds. This is a rare cancer, but if you're over 60 and experiencing strange fatigue or bruises, it's worth knowing about, because early signs are often mistaken for just getting older. Now, what causes these cells to go rogue? We don't know the exact spark, but think of it like a typo in the cell's instruction manual, your DNA. Over time, small mistakes build up in white blood cells, especially in a gene called MYD88, found in over 90% of WM patients. It's like a broken-on switch that keeps the cells multiplying. It's not something you catch from others, it's not contagious. And while you can't catch it like a cold, some factors raise the risk being older male or having a family history of blood cancers. It's like inheriting a slightly faulty battery in your body's system doesn't mean it'll fail, but needs watching. So how would you know if something's wrong? Let's play detective. Have you noticed that your hands or feet feel numb, like they're asleep all the time? That could be thick blood slowing nerves. Or maybe your gums bleed when you brush gently. Or you feel full quickly when eating, like your belly is pressing up on your stomach. That's your spleen or liver swelling. Some people notice dark spots on skin or constant chills. Others say, "I can't stand cold anymore, fingers turn blue," a sign called Raynaud's. And the vague symptoms: extreme tiredness, weight loss, night sweats. They're easy to ignore, but if several happen together, it's time to check your blood. How do doctors find this hidden problem? First, they ask about your symptoms and do a blood test, like checking the oil in a car. They look for high IgM levels, the thick protein, and low red blood cells, anemia. If those are off, they might do a bone marrow biopsy, a small sample taken from your hip bone to see if the factory is making too many odd cells. They might also scan for swollen lymph nodes or organs. Treatment: not everyone needs it right away. If you're stable, doctors watch and wait. But if symptoms bother you, treatments include drugs to kill bad cells, like ibrutinib or rituximab, plasmapheresis, a blood filter to remove thick protein, or even chemo. It's like cleaning a clogged pipe, sometimes gently, sometimes strongly, based on how bad the blockage is. Can you stop this from happening? Not fully, since we don't know the exact cause, but you can reduce risks. Think of your body like a car. Regular maintenance helps. Avoid smoking, it adds stress to your blood system. Limit alcohol, eat fresh foods, and keep up with checkups, especially if a family member had blood cancer. While you can't prevent the gene changes, staying healthy gives your body a better chance to cope. If you're over 60 and feel off for no reason, don't just say, "I'm tired," push for blood tests. Prevention here means early spotting, catching the whisper before it becomes a shout. Science is moving fast. Researchers are testing new drugs that target the broken MYD88 gene, like fixing the typo directly. CAR T-cell therapy, where your own immune cells are trained to hunt bad ones, is being studied for WM. New pills like zanubrutinib are showing fewer side effects than older ones. Also, scientists now understand that some people with WM have other gene changes, like CXCR4, that affect treatment, so testing helps pick the right drug. In trials, some patients have gone years with quiet disease. You can even join research studies. It's like being part of a team inventing better solutions. Hope is growing, not a cure yet, but better, kinder treatments.